At this time, I'd like to recognize our Berks County Director of the Department of Emergency Services, Brian Gottschall, for the weekly Berks County COVID-19 data report, as well as the biweekly Co-County Wellness Update. Brian Gottschall.
Good morning, Commissioners. I'm glad we were able to start out with something kind of pleasant and holiday-like, because our weekly report certainly does not fall into that category. Taking a look at our cases and testing, we continue to see a steady upward rise in cases in our community. A significant amount of positivity among our testing that is being done, representing a lot of COVID spreading again within Berks County. And this is the case throughout Pennsylvania, and as this slide shows, throughout the nation. Just a couple weeks ago, we were kind of jealously looking at Chester County and Philadelphia County, who appeared to be peaking out of their Delta surge. And they had actually dropped down from high to substantial case transmission. And we were kind of hoping that perhaps we would be headed in that direction soon, giving us the option to not have to mask in conformance with CDC guidelines. What we now see is that much of the gains throughout the nation that happened over the last number of weeks are now reversing. You can see that in all of the categories below low, counties have moved into worse conditions. In essence, that each of those categories has had a reduction in the number of counties nationwide, while the high transmission rate has had a significant growth in the last 7 days. Our pediatric cases in the 5 to 18-year-old group continue to bounce up and down, but as such remain relatively flat in a long-term trend. We are seeing continuous slow growth over the last number of weeks in our 0 to 4 category of ages, though. Things continue to look progressively worse for our hospitals. If we would just go back to the middle of November, we were looking at about 50% of these numbers in our Berks County hospitals. We continue to see the largest percentage of those involved in hospital interactions, both as far as general admissions, as well as in ICU and ventilator cases, being those who are in the unvaccinated categories, though. Continuous slow climb in our COVID deaths. This has been a theme now for months, where we don't see the nice flat slope that we had seen back through the summer months. We are just seeing a continuous slow climb week after week. Vaccination numbers, really not a whole lot to report about. Continued slow development in both our fully vaccinated as well as our at least one dose. We again can't look at our corrected numbers for one dosers due to the data correction that CDC did a couple of weeks ago. It's going to take about 4 or 5 weeks of data until that kind of flattens itself out and we can begin to work those numbers back into the equation. At our Berks County Cares Clinic, as we mentioned previously, we're closed for the holiday week, but we're open last week and saw the largest usage of the clinic in that last week, with 359 doses given during the hours that they were in operation. There is capacity there, and we would continue to encourage people to utilize Penn State's registration system, which is available as a link through from doyourpartberks.com to register for vaccine there or at any one of the providers throughout the county. One interesting change that we're seeing is for many, many weeks, in fact months, we have been leading Pennsylvania's growth in vaccinations in almost all age groups. In essence, that in Berks County, we were seeing our vaccine growth since the end of March outpacing the growth in Pennsylvania as a whole. That trend is starting to reverse itself, and Pennsylvania on average is now beginning to outpace Berks County as far as that new growth or new folks pursuing vaccines since the end of May. As we've done for a number of weeks, we want to keep an eye on influenza. The red line with the circled data points in the lower left-hand part of the graph represents this year's influenza growth, and then each of the colored lines representing other years in the last decade. And what we can see here is that in Berks County, in Pennsylvania, we're seeing influenza growing at a rate that is greater than what we had seen it grow in any of those other prior years. A reminder to folks that in 2020, 20 into 21, the first year where we had an overlap of COVID and influenza, we were very much protected from influenza. That's the yellow line on the bottom of the graph that is very flat all across by our COVID mitigation measures. As we've seen the public not adopting those mitigation measures with the same level of aggressiveness this year, we're likewise not seeing that protection from influenza, and we're seeing our influenza numbers grow at a very concerning rate. While the slope is very steep, and the rise off of the zero line is much earlier than in many years, in all of the years in the last decade, I do want to point out that we still do have kind of exit ramps for these numbers. We have the opportunity to correct this, to flatten that curve, and hopefully make it look more like 2015, 2016 year, the light green, where we only got up to this 4,000 cases in that week. This is all within the public's control to make those types of changes if they would choose to. Not a whole lot new to say on our vaccine recommendations, and assuming CDC doesn't make any changes over the next week, we'll begin to back these slides out of our weekly report, not waste time with them, because they have now stabilized as far as what the vaccine recommendations are for the age groups and how boosters are to be handled for the various categories of folks now. Getting into our current events and things on the horizon, we mentioned last week that the FDA advisory panel had approved or had recommended approval of the Merck oral antiviral, and we thought that there would be a decision from FDA one way or the other very quickly on that. That has not been the case, and we are still waiting for an FDA decision on that oral antiviral. Likewise, we're waiting for Pfizer to submit its final data to FDA to begin the process of potential approval for its oral antiviral. So as it stands today, our infused or subcutaneously injected monoclonal antibodies are really the treatments that are out there. This hoped for home solution for antivirals is not yet something that's on the table for usage. This is a lot going on this slide, but it's also a lot of the interest right now in COVID, and that is the COVID variant that has been deemed has been determined to be called Omicron. We're now starting to see lab data come in, primarily from South Africa and other locations where it was more prevalent and earlier. There's really some good news and some bad news in this. I'm going to tick through it a little bit with some narrative. On the good news front, we see that this variant is using the same what are called ACE2 receptors, the binding points on our cells where the virus connects to. And this is kind of a key and lock kind of thing. If our cells had binding points that looked like triangles, but the virus had binding points that looked like squares, they wouldn't match up, and the virus wouldn't be very good at getting into our cells. So one of the ways that we address diseases, and this is not just COVID, but viruses in general, is by making vaccines that tie up those binding points so they can't get in. But that means that the vaccines have to have binding points that look like whatever version of the virus they were developed to address. And the good news is that the binding points of the Omicron variant look similar to the binding points of prior variants, and therefore the belief is that our vaccines will be reasonably good at binding up to those same points and doing their job. On the bad news front, it appears as though the Omicron has binding points that are more aggressively able to get into cells when there is not protection there. And as we look at vaccine efficacy through the use of what are called convalescent plasma studies, where they basically take the plasma, the blood of people who have developed immunity to some extent to COVID through either vaccine or prior infection, and they bind and they mix that with this new variant to understand how things are going to work out. We're seeing a significant reduction in the neutralizing antibodies effectiveness as compared to what was there against Delta. And while that's bad, the good news is that it's not as bad as was originally expected. So when we were first understanding about Omicron, there was a great deal of concern. And while that concern appears to have been founded, it is not as bad as we thought it might have been with respect to the development of neutralizing antibodies against this particular variant. And in fact, when a booster is involved here, or I'm sorry, I should say when prior infection is involved here, along with vaccination, there is a significantly better outcome than that 40-fold reduction. And the hope is that that reflects what a boosted response might look like. And all of this that was determined by the Africa Health Research Institute is supported by Pfizer's own internal findings about the efficacy of their vaccine. We still have to find more out about the other vaccines that are out there. And we also want to have an eye to another study that was done by the University Hospital of Frankfurt. This was reported on by the virologist that led that study, Sandra Cizak, through her Twitter page. In that case, the findings were actually significantly less desirable than what was found in the AHRI study. So it's important to understand that all of these studies are still what are considered pre-publication. They were not yet peer-reviewed and formally released, but we're trying to look at the information that's available out there as early as possible, give it the credence that it's due, but understand that it is pre-publication. The last thing I want to mention on the good news front is that we have to remember that while all of this vaccine stuff is very important, while neutralizing antibodies are critical in the fight against COVID, we have other means in our immune systems to help protect us against the virus. And those other means are B cell machines, our killer T cells, as they're called, are also things that we have to consider in how our bodies are going to be able to respond to Omicron. Much to be written about this yet, but we want to get the information out there as early as we can. So we also want to look at like how things might be different in South Africa compared to how they might be in the US. And of course, in the US, we have a much higher vaccination rate. We are also still in a significant Delta surge. If you look at the South Africa data, their Delta surge had peaked back in early July, and they were very much on a downswing and actually in a bottom valley of COVID transmissibility in their country. We, of course, are still very much in a Delta surge. And the hope was that our high vaccination rate, as well as the fact that we have a lot of resistance that's in the community due to the prevalence of Delta in people today, were going to help to harden us against Omicron. And the unfortunate fact is that as we look at information coming out of the UK, which much more looks like us than South Africa looks like us, that is not playing out to the extent that we had hoped. So again, the kind of good news, bad news side of things that we want to talk about here. It's very difficult to look at hospitalization data from other countries and transmit that or compare that to the United States because of significant differences in our hospital systems. And we also don't know very much about what long COVID will look like with Omicron. Is it more likely to create long COVID or less likely to create long COVID than original COVID or Delta or Beta to a lesser extent, which are the variants that we've dealt with here in the United States? And there, of course, will be weeks until we understand what the death outcomes are from Omicron and can understand that mortality data. So we're going to try to continue to give the best, most available information that we have, and also clearly explain the sources of that data so that people understand in some cases that it needs to be taken with somewhat of a grain of salt. We want to remind everyone that we have public COVID drive-up testing here outside of our offices at 2561 Burkeville Road. That testing is continuing to be offered as planned in the dates and times shown. And we also want to mention, as the Reading Eagle helped us to make known to the public, that we've been able to extend that testing to now include dates going out from 12/14 through 12/22 at the dates and times indicated. You don't have to worry about writing all of this down. DoYourPartBerks.com has all of this information available to you anytime you want to go look it up. Just a reminder that the best access to get into that testing is from 183 onto Van Reed Road and then turning into the parking lot as the red arrow indicates. There are signs posted locally to help you kind of get directed once you get in the area here near the building. Want to take a look at our Cook County wellness numbers as we do every 2 weeks. What we see here is that their workload is going up dramatically. You can see that the sum of all of these numbers representing what they've done in the last 2 weeks is significantly higher than the sums in the 2-week periods prior. So they're getting a lot more case investigations coming to them. However, based on the size of the bars and how they compare in a 2-week period, you know, red to red, orange to orange, green to green, what you you see is that we're really not seeing any improved effort by the public to help cooperate and work with them as these case investigations are being done. The percentages of successful contacts and ultimately of case investigation questionnaires returned is remaining very much the same, even though Coe County is doing a lot more work because a lot more cases are there to be investigated. Likewise, in contact tracing, we're seeing very similar public response, despite the fact that there are more contacts being worked based on our increased case numbers in the community. So we have to take this opportunity to again encourage the public to please work with our public health partners who are trying to do case investigations and contact tracing to let other folks who may be exposed to the disease know that they've been exposed so that they can make the decision to take the right steps and quarantine themselves until they're tested and cleared as far as their potential for being further vectors of the spread of the disease.
And Brian, please note that confidentiality is a critical piece of this. If you could explain how that works, I think sometimes we take that for granted that people understand that.
Absolutely. The folks that are doing these investigations are professionals. They understand the need for confidentiality. They've got a great deal of experience and history in doing contact tracing and case investigations, primarily for sexually transmitted diseases prior to the COVID engagement, but these folks are not sharing your information with anyone. No one here at the county, you know, we get this type of data that's de-identified. We don't know anybody's personal information. That's a matter of confidence among the involved parties, the Department of Health and Coe County Wellness, who's providing these services. So folks can feel free to share, understanding that their data is being protected and no names or demographics that could tie back to a name are being shared with anyone. Thanks for bringing that up, Commissioner. So the last thing we want to talk about in the current events is, and I saved this slide at the end because I really wanted to wrap up the presentation with it because it is so important, so current. We've been talking since the spring of 2020 when we first understood COVID about healthcare impacts and the risks of overwhelming our hospitals. And I think that we need to qualify this by saying overwhelming means different things to different people. So some people might think that our healthcare system is overwhelmed if they have to wait an hour in the ER, and other people may not think it's overwhelmed until there are individuals laying on, you know, leaf mats on the sidewalk outside of the hospitals. I would say that the real truth is probably somewhere in between, and this is what we want to convey to the public, that we are no longer in a hypothetical of what if our healthcare system is overwhelmed. It is overwhelmed now. And this is as much about people as it is about beds. We need to care for the people who are providing these services in our hospitals and healthcare institutions. And the reality is that they are beat up. When you talk to these people, there's not a lot there behind the eyes. You know, they have seen it all, they've done it all, and they need a break. And there's nothing that can be done by our local governments. There's nothing that can be done by our local hospitals to give them a break. The public now needs to step up and recognize that we are in a position that we really need to begin caring for our healthcare institutions as critical community resources now, or else we're going to get to a point beyond where we are now, where the public is going to start to feel the outcome of those impacts, even beyond the level that they already are, which is right now in long waiting times to be able to get non-acute care. We don't want anyone to fail to use the healthcare system when they need it. God forbid we have someone sitting at home with chest pain who says, well, I'm not going to call an ambulance because I heard that guy talk about how busy they are and I don't want to be part of the problem. That's the other extreme of the issue. We don't want people to avoid calling for EMS, going to the hospital when they have true, potentially life-threatening medical emergencies. But what we do want people to do is stop using the EMS system and the ERs in place of having a family physician when they have a minor ache and pain, when they need to get some a medicine refilled or those types of things. This is going on right now, and we need folks to understand that ambulances are not going to get you care faster your condition is going to do that. Whether you go to the hospital on foot, by taxi cab, in your own vehicle, or in an ambulance, you're not going to get seen any faster because you come into the ED in an ambulance. You're going to get seen at the ED based on the condition you are presenting with. And if you go there in an ambulance and you didn't need to, and the condition you're presenting with does not speak to the need for immediate care, you're going to get taken right out to the front of the waiting room, no different than somebody who walked in off the street is going to get sent to the front of the waiting room. So number one, we need the public to begin using the healthcare system more responsibly, making good choices between using the emergency room, going to an urgent care facility, or going to your primary care physician or a walk-in type clinic. The other thing we need the public to do is to get very serious about tamping down both COVID and influenza. We understand that these are personal decisions, and we're not going to be able to convince people who have made up their mind about things like vaccine, about things like masking, about things like social distancing to make up their minds. But for those of you that are on the fence, or those of you that are attempting to care for your fellow citizens and our healthcare systems, we would say that now's the time to buckle down. Do what you can, that you will, when you can. If you're not going to be 100%, maybe you're opposed to vaccines, but you're willing to mask, or you're willing to implement other mitigation measures that we've talked about now for the last 20 months. Now is the time to do it, because we're seeing healthcare impacts beyond those that we've not seen in the past. For the first time in my career, we had both of our Berks County hospitals on ER Divert, basically running the flag up the pole and saying, if there's the ability to take patients to other hospitals, do so, because we cannot take them here in the fashion that we would like to take them and care for them. This is huge. This means that people are being asked to go to emergency rooms in other counties. What actually put our emergency rooms over the tipping point the other night is the fact that in a 1 hour period, we had 10 patients coming in from other counties that were diverted from other hospitals. So this is not a Berks problem. It is a healthcare problem. It is a broad community problem. And we need to emphasize to the public that the solution to this problem rests with every man, woman, and child doing the right thing, so that we can better protect our healthcare institutions and our caregivers in those institutions from the incredible volume that they're seeing that is on an upward, not a plateau, not a downward trend, but an upward trend right now. So I hope that wasn't too preachy, commissioners, but we really do need the public's help with this. And as always, we direct the public to doyourpartberks.com to find resources about COVID vaccine, and about COVID testing. If there are no other questions or comments, back to you.
Thank you very much, Brian. That is certainly a sobering report. And hopefully our public and Berks County residents will take it to heart.